Hello, everyone. Welcome to the webinar, The Art of Engaging Older Adults in Research. The webinar is being recorded and it will be posted on the GSA website, and a notice to all attendees will be distributed once the recording is available. So a question and answer session. Oops, let me make sure the slide's advancing. Yes, there we go. A question and answer session will immediately follow the live presentation. We will be accepting questions through the questions feature, which is accessible on the GoToWebinar panel. Also located there on the panel are downloadable handouts for today, actually a copy of the presentation slides. So while I introduce our speakers for today, we're going to launch a fun polling activity so that we can know who you are. So let me launch this, and there it is. So please tell us who you are by answering the poll that appears on your screen now. So the presentations today will be given by Amy Eisenstein, Program Officer at the Retirement Research Foundation, Carol Geary, Postdoctoral Research Associate at University of Nebraska Medical Center College of Medicine, Erin McGaffigan, Policy and Research Fellow at Leading Age Long-Term Services and Support Center and University of Massachusetts, Boston, and Gyasi Moscu-Jackson, Nurse Scientist at University of Maryland Medical Center. So I just want to take a moment to thank Amy, Carol, Erin, and Gyasi for bringing us this important program today. And before I hand the baton over, let's launch this poll. Here we are. Okay, well, without further delay, I'll hand the microphone to Amy.
Thank you, Judy. You could go ahead and flip to the next slide for the agenda. Before I begin, I just want to talk a little bit about how we came together today. We are members of the Patient in Person Engagement and Research Interest Group, sponsored by GSA, and we are really excited to be working with GSA to get this information, to have this opportunity to share with you about the importance of engaging stakeholders in research and to share some of the lessons learned that we've gained by doing this work. So thank you for signing in today. And again, thank you to GSA for this opportunity. So this webinar today highlights two diverse research advisory boards that are working to bring the experiential voice of older adults into research. Researchers are working with these advisory boards will discuss their unique models of engagement, use of technology, and experiences in recruitment, training, and sustainability of their research advisory boards. So today, I just want to go over the agenda. We're going to start with a very brief introduction and overview of engaged research in aging. Then our two panelists will have an opportunity to discuss projects that they've been working on that focus on learning how to engage stakeholders in research. They'll provide an overview of their models of engagement. They'll highlight some of the lessons learned from their experiences, and they'll touch on where they're going from here and how they're really working to maintain this level of engagement in their work as well as others' work in the field. Finally, Dr. Moscu-Jackson will wrap up the discussion by pulling together the key elements from the two presentations and introducing additional resources that could be of value to researchers and providers looking to engage older adults in research. We really want to emphasize that these are just a few models. We're hoping you could take some of the lessons learned and continue to build on these to work towards engaging stakeholders in your research. Next slide, please. So, as I mentioned, before we get into depth about the projects, I want to provide a little bit of background. The projects that we're discussing today have been funded by the Patient-Centered Outcomes Research Institute, an independent, nonprofit, non-government organization located in DC. I want to share a little bit about their mandate to help give some perspective as to how we got onto this path of work and why we're doing kind of how our work funnels through. So their mandate is to improve the quality and relevance of evidence available to help patients, caregivers, clinicians, employers, insurance, and policymakers make informed health decisions. The goal of their work, and relatedly, the ultimate motivation behind the work of our panelists, is to determine which of the many healthcare options available to patients and those who care for them work best in particular circumstances, and to help overcome the many historical, generational, and cultural barriers to engaging the non-usual suspects with research. And we know in order to accomplish these goals, we really need to engage the stakeholders in a meaningful way. So PCORI really focuses on doing this by maintaining strict adherence to 4 principles of engagement that were agreed upon by their stakeholders. These 4 principles of engagement are reciprocal relationships that entail shared leadership, for example, between an academic PI and a community PI, a principal investigator. The second is co-learning, education and training activities which enable shared understanding of research and its purpose and value. And both the community and the academics need to commit to that learning process. The third is partnership, a process for developing collaboration and building capacity to work together. And the fourth is trust, transparency, and honesty, really working to build a culture that enables collaborative working. So overall, the goals of engagement are to make health research which supports equitable healthcare delivery, specifically ensuring that research findings are relevant to the people. Over the past years, we've seen a trajectory of research stem from traditional research to community-placed research to community-based research, all in an effort to reduce the time gap between research and practice and to improve the health of the population. Next slide, please. I'm going to move a little bit more into the specifics, some of the specifics around aging. Stakeholder engagement is critically important in research and aging. The experiential voice of older adults is largely absent from health research, which often leads to the development of ineffective programs and policies. While older adults certainly have the capacity to participate in the design, the development, and the delivery of research, researchers don't always recognize this capacity. They may be unsure how to seek their input, or they may not fully appreciate the extent to which this input can improve the research enterprise. So those are kind of really emphasize some of the reasons why we've come together as an interest group and why we're here presenting this information today. So, however, we know that including these stakeholders in research can ensure the patient-centered research meaningfully addresses older adults' care preferences and desired outcomes. It can ultimately improve the effectiveness of programs and policies, as well as quality of care and quality of life for vulnerable older adults. Using innovative solutions to allow this work to happen, which is what we'll be talking about today, such as innovative evaluation, technology, biosketches that reduce power dynamics and create equity, will all help improve the care of older adults. So about 4 years ago, we started the development of the Bureau of SAGES, a research advisory board whose mission is to empower nursing home community members and homebound, or what they prefer to be called stay-at-home older adults, to learn and collaborate with researchers to advocate for timely, useful studies that matter to them. The group began with the purpose you see here of bringing together those typically excluded from research to learn about and discuss research concepts in order to provide voice to the direction, design, and implementation of national research on aging. Since its inception, we've seen more and more projects working to build models of engagement and create opportunities for stakeholders to participate meaningfully in research. Engagement in research goes beyond using older adults as participants, or really we want to get beyond qualitative work, engaging older adults in focus groups, but really engaging them as experts on their experiences. They should be the ones defining the problem, contributing to the design and practicality of the intervention, reviewing materials, and aiding in interpretation of the findings. Next slide, please. So today, We're here to present on the ways that stakeholders are being formally engaged in research in meaningful ways. We hope you'll pick up some of these tips, pointers, and ideas from this presentation and help us move forward in ensuring that all research is being done in a way to meaningfully engage stakeholders. We certainly recognize this is just kind of a smattering of some of this work that's being done. Today, our panelists will talk about the bolded projects that you see here in front of you, and just want to really just to express a little bit the extent of this work going on. We've collaborated in some of this work with colleagues across the country. University of Texas Health Science Center is looking at how to provide better palliative care for people with dementia and their caregivers. Places like University of Utah and Vanderbilt are using studio models to engage stakeholders, which are structured settings for learning from community experts. And Johns Hopkins is working to engage homebound people and their caregivers in the development of home-based medical care. There are many models of this being done throughout Europe. The list goes on and on of the populations that are being specifically covered in the discussions. So for today, we've asked each of our discussants to think about 3 questions as they present. One is to give us a brief overview of how their work is engaging stakeholders in research. 2 is what are the key takeaways or lessons learned that they can share with others working to engage stakeholders in research. And 3, what are the next steps for their advisory boards? So with that, Judy, if you could please switch to the next slide, and Carol can take over discussing her work.
Thank you, Amy. Today, I'm excited to share one portion about an ongoing project that's funded by PCORI to build patient and stakeholder engagement capacity. Our focus is on identifying and testing tools and resources specifically for engaging patients and stakeholders who are both rural and distant from the researcher. And it's this distance that required an atypical approach to engagement for our project. I'm excited to share a bit about our atypical approach and also some formative learnings. The project is still ongoing at this time. Next slide, please. So the project was designed in 3 interdisciplinary and engaged layers to enable us to build capacity by doing engaged research and then using the tools and resources in the process. So in the top layer, that blue layer, we have 10 research teams that are currently working together. They're designing research, applying for funding, and actually completing research together. And then the green layers beneath are there to support the teams through education, through managing the administrative and operational processes, being a resource when we're needed, and then also in evaluating what's working and what's not working. At the very bottom there, the co-leads have day-to-day responsibility for the overall project. And then in the middle, the steering committee has helped with planning, overseeing, and completing the project. And their insights as rural patients, stakeholders, and researchers themselves has been critical to our success so far. And we anticipate everyone's involvement as we disseminate findings next year. Next slide, please. So this slide highlights just a few key points to our approach within our project. As I described earlier, we're taking a learn by doing approach in the project. So we really plan to allow significant times for these research teams to work together. And we started with this identification of partners by publishing a request for proposals that we based upon one that was completed by the Healthy Heart program earlier. And we published it across multiple universities targeting researchers. We didn't limit the stage or the topic of the research, but we required an engagement plan and we required a rural focus. 10 projects were chosen at the beginning of 2019. So our next step was actually to clarify what an ideal partner for these research projects would look like, and then started the work of identifying nearly 50 patient and stakeholder partners, 5 for each of the 10 projects. In this identification process, we reached out through every trusted network that we could identify. We used resources from our clinical partners, our College of Public Health. We reached out quite literally to family and friends and community resources in communities that we didn't know. And in the end, we reached out to partners who had agreed, patients and stakeholders who had agreed to be part of research teams to help identify others. Between March and August of this year, we identified partners from communities that ranged from an hour away to about an 8-hour drive from where we are geographically. So one method that was decidedly missing from our approach was that face-to-face meetings in targeted communities that is so typical in community engagement. So after we identified the partners, co-leads held one face-to-face meeting in the partners' communities. So we drove to all of these communities to meet with our patient and stakeholder partners in their hometowns. And in this meeting, we confirmed their interest in a specific research project. We shared more information about the research that we were doing and our funding, and then we completed paperwork for them as well. We used this meeting to demonstrate our commitment to them and our willing to work with them across the distance. And from the overall perspective, perhaps the most important thing we did was we shared with them that as co-leads, we would be handing the baton to their researchers at our summit meeting, which I'll share more with in just a moment. But at that point, they would connect with their researcher and they would form a team to actually do the research work together. So the summit was an incredibly important time for us. This was our only live, that is non-email based training, and our only planned face-to-face with the research teams. Next slide, please. So the picture you see here is of our summit. 8 of the 10 teams met together in a 1.5-day meeting held over a Friday and Saturday in a location that was as close to Central as we could possibly make it. The energy in this room was really palpable. Each of the research teams left with a plan for how they would continue to work together. And most importantly, the beginnings of their relationships were formed. Now the teams are working independently together on whatever project they agreed to in this summit meeting. Next slide. So what have we learned so far? So first I'll talk about our organizational findings. When we were identifying partners, we were frequently asked questions about our ethical access and limitations to our IRB. We really had to pull together tight messages about the differences between participating in research and being a partner in research. But most importantly, we had to define our boundaries in our institution, as well as in those partner institutions who helped us identify folks regarding what was acceptable in reaching out and how we could do it. We made multiple simultaneous attempts to identify interested partners with the needed lived experiences for each of these 10 studies. Some of the researchers were able to successfully identify their own teams by working with their clinical partners. Some researchers just needed help with initial calls and administrative connections. Others really needed our co-leads to deliver them a complete team to the summit. And we were able to use all of these approaches and still remain within IRB, HIPAA, and institutional boundaries. I think it's important to share, though, that one of our best methods for identifying these partners was actually snowballing. As an example, we had our most difficulty identifying cancer survivors. And in the end, our most successful approach was going back to those people who we had met with in their local communities to say, we've got 2 teams that really need more help. Can you help us find cancer survivors? They connected us with their friends, their family, and fellow survivors as well. In terms of payment, when I started research on how we wanted to pay these folks, I heard multiple stories and multiple approaches from different PCORI-funded sites. In the end, I found that these approaches to payment differ from one institution to the next. And so we worked really tightly with our accounting staff and found one way to pay all of these folks that was within our funding boundaries and within our organizational boundaries. Next slide, please. So for our researchers, their topic, their scope, and their timing really played heavily into identifying who their ideal partners were. And we started having them frame this by using a one-page description, and we stole this format from another PCORI-funded effort, and it worked beautifully to communicate key details to prospective partners. We did not define our research requirements in terms of stage or anything specific. We do have folks who are designing research. We have folks who are implementing an intervention that they've already piloted. The one thing we don't really have here is a dissemination effort, and I'll be excited for the opportunity to do dissemination using this model in the future. We did find that researchers who had worked in team science found this process more comfortable than those who didn't have it. However, all of these researchers and all of these teams developed their goals for engagement, and all have really embraced the team science partnership model. Next slide, please. So as I said previously, we needed and we found about 50 partners. All of them were rural and distant from the researchers, but most importantly, all had lived experience related to one of the research projects. We connected with all of these partners based on a mutual trust. Some accepted cold calls based on recognition of my phone number as a clinic number. Others answered an email based on past research experience or an introduction by a trusted source. But all of them had some connection that encouraged them to trust that this was both an important and a legitimate opportunity. Now, the true connection to the research, though, was the partners' lived experience. Each of them had an interest in delving into research on this topic. Some of them were giving back because they were pleased with their experience. Others wanted to help improve the experience because they weren't pleased with theirs. And some were just curious. But all of them had a story to tell about their lived experience related to the research, and all of them had an interest in sharing their story. Now, it's also well documented in literature that for partners, their lived experiences, and often the ones that attracted us to them, can interfere with their ability to engage in research. Several of our research teams have experienced issues related to this, but as long as the researcher and the partner are able to stay open in their communication, they have all been able to identify opportunities to continue working together. Next slide. So for us, next steps, the research teams are working towards their goals. We will be surveying them twice more to see how their teams have progressed and what has worked and what hasn't. And I look forward to sharing the information when it's available. In the meantime, we continue to support our existing research teams through coaching and in support and providing resources. And we continue to support just-in-time connections for requesting researchers as new needs arise. I believe we're going to take questions at the end. So at this time, I'd like to turn the microphone over to Erin.
Wow, thanks, Carol. This is Erin McGaffigan, and for those who joined late, I'm a Research and Policy Fellow at the Leading Age LTSS Center, and I run a stakeholder engagement organization. I'm going to talk to you specifically about my experiences working with the Bureau of SAGES model that Amy had referenced earlier. The Bureau of SAGES model, Amy has pointed out, started in 2016 and has run a few phases now. It started with developing just a couple of advisory boards and then has grown to develop similar models of advisory boards across the country. So we're really excited about that. I have had the pleasure of providing some technical assistance and support to two specifically, the Jewish Home of Eastern Pennsylvania in Scranton, Pennsylvania, sorry, and the other being Hebrew Senior Life. Now, Jewish Home of Eastern Pennsylvania has been around for about a year and a half now, whereas Hebrew Senior Life is just getting started. And I think I will point to experiences with both that I think you will find helpful. I'm also going to pull from experiences developing a steering committee for a new symposium that's coming up in the spring of 2020, and I'll talk a little bit about that. But that symposium has both researchers and people, older adults, on the steering committee. So that has had some great lessons learned that I'll pull from as well. And then I've had the pleasure of talking with a great deal of people that are involved in some of the other Bureau of Sages. So I'm going to pull from those experiences if they don't mind. I'm sure some of them are actually on the call. So I want to just say, thank you to both, to Amy Eisenstein, who's on the call, but also Rebecca Berman and Rachel Latham, who have been playing a meaningful role over at CJE Senior Life and the development of this model. So thank you guys. Next slide. So as Amy had mentioned, I'm going to go ahead and give you a brief overview of the elements of the Bureau of Sages Research Advisory Board model. So this is a advisory board model, so it's slightly different than what had Carol described. There's some basic elements, even though each advisory group looks slightly different. There's some basic elements we just want to walk you through so you know what we're talking about here. So in these research advisory groups or advisory boards, it's usually a small group of consistent older adults, usually probably about 6 to 8 individuals who are meeting routinely. The Bureau of Sages model happens to be happening in the community settings, but also facility settings. We even actually have one that is a virtual setting. And I think what's important to know is that with the small group of consistent older adults, they're receiving some sort of training up front, some sort of orientation about what is research, basic concepts of research, what to expect when engaging with researchers, and then some ongoing training and support as they go, maybe reviewing some journal articles to understand existing research projects and to even tackle, when they're not working with the researcher specifically, tackle how that research project was done and what were the strengths and weaknesses of the methods. All of these research advisory boards meet routinely. They get, that's part of getting to know each other and to understand their role in research. So for some that means monthly, for some that means maybe twice a month. And for some it might not be every month, but it's pretty routine enough for which when a project or a researcher comes and asks for assistance, they're ready to provide it. Now in this research advisory board model, the older adults are providing experiences or input into a wide range of research topics that come up. Other research advisory boards I've seen or have experienced, it's one project that they're working from day one all the way to the end, similar to what Carol had described. These ones that we're working with the Bureau of Sages are actually open and engaging researchers from various different topics at various different parts of time. So for instance, in Pennsylvania, we have seen that advisory group provide some guidance on methodology around evaluating the impact of resident councils at nursing facilities, because that one is actually in a nursing facility. Also, non-drug interventions for behavioral health and dementia, care planning, with chronic kidney disease, and even more recently, the role of robots in supporting individuals as they age. So a wide range of research topics. They also have a facilitator and staff support. So just something to keep in mind, although it's happened differently for each advisory group, there is somebody that's really kind of getting the group going, making sure they have agendas, making sure they're prepared for meetings, and even supporting researchers to get ready for those advisory sessions. Next slide, please. So I'm going to talk a little bit about our lessons learned from this model, and there's lots of lessons learned, and you'll see a resource page at the end. So by all means, plug in and see all the different experiences we've had. But there's a few that really I wanted to make sure I left with you today. The first is older adults want to be engaged. What we've noticed with this work so far is we've actually had a pretty easy time identifying older adults that want to be engaged and show up to meetings and participate. If anything, and the reason why we're doing that SAGES symposium I'll talk about in April, is the challenge is actually getting sometimes researchers to the table to do the engagement. But we have found older adults are ready. The trickiest part is locating individuals and developing meaningful ways to get them engaged. And Carol had mentioned a couple of those points. So what I would like you to think about if you are interested in figuring out some sort of engagement process is really stop and think about who you're trying to learn about. What are the characteristics of maybe of your research project for which the older adult characteristics are needed? And then stop and ask yourself, where are they living and experiencing life? Who are the relationships they already have, the partnerships, the providers, and whether or not they could actually be tapped to engage older adults. Because ultimately, I feel like the most successful engaged research is happening where older adults are actually living and enjoying work. I mean, enjoying life and volunteering or working. So keeping that in mind when you find yourself difficult to find older adults. I'll put a plug in right now for some outreach partners, nursing facilities, departments of social work we have found have been helpful, senior center community activity coordinators, area agency on aging advisory councils that might already exist, might want to play a role in your research, patient and family advisory committees from managed care groups, health plan so from hospitals, and then health plan member advisory committees. And then again, if you don't want to design your own research advisory board, keep Bureau of SAGES in mind because we have multiple groups going on across the country that you can tap and are ready to engage in your research in different settings and working on different topics already. So if you're looking to outreach to older adults, think word of mouth. I heard snowballing in Carol's description. Provider newsletters is a great way to ask for some involvement. Outreach flyers at partner sites, putting them up in their community section. Coffee hours at community meetings at resident or housing sites or facility sites, and community events, think flu clinics or other events like that where you might be able to find individuals. So I just want to put a plug for working with allies. They'll help you. I mean, partners, allies of older adults will have great ideas on how to outreach to them. Next slide, please. So the other takeaway we have from Bureau of SAGES is that technology can bridge divides. I think there might be some assumptions among some of us that older adults are less likely to use technology, and I do think that there are challenges. I'm not going to downplay the challenges with technology. We're experiencing that in even our own existing steering committee as we speak with the SAGES Symposium. But we have found that, to Carol's point in the rural environments, that meeting in person can be cost prohibitive. It can be difficult for travel. It can be functional limitations of older adults can get in the way of it. Researchers in our work we've even found have a hard time getting to the Bureau of SAGES to even engage. So technology, I think, should be considered. And I think what is helpful is to just step back and spend some time asking, what are people's needs for technology? Do people already have technology? Do they use it? Do they have smartphones? Can we provide stipends now or in a future budget for really cheap $30 cameras, or can we provide some one-on-one support, maybe an intern to spend some time before meetings to troubleshoot challenges getting on technology? I really have found having a champion, paid or unpaid, who frankly just is invested in engagement, who's ready to spend the time in any of the above, to be extremely helpful. Combination process, hearing Carol talk about the engagement of the summit, I think we have found examples of what I'd call bookends very meaningful, where you might bring some people together in person at the initial site, initial point of contact to develop rapport, but then use technology ongoing, and maybe even use it in person again at the end to share findings, that type of thing. Next slide, please. So here are some examples of technology, and I would say my favorite, and this is not a paid endorsement, is Zoom technology. I find that it is an easy click, one-click access for video conferencing. Another one I tend to see is our virtual, there's a virtual senior center that's doing a Bureau of Sages model, and that's example of it in the bottom left-hand corner, where you could use virtual technology one click to get people who are already using a virtual senior center engaged in Bureau of Sages model or advisory group model. The other two examples, the far left right corner, top left, and the bottom right, are both project management tools. So Basecamp, if you're familiar with it, is a great way to get people with different stakeholder groups together in a project and to keep one place to share resources and information like tools and resources to educate people on what you're trying to accomplish. It also has a messaging feature. And then that bottom right hand side is an example of a what I call a virtual binder, and it is a free tool that you can use, and then you could pay after a few different binders, but it's one place where people can click in and see your membership for your advisory board, or even your whatever engagement strategy you're using, your agendas, and then tools and resources. We're using this right now with our SAGES Symposium Steering Committee. So I think that's next slide, please. So as I wrap up here, just a couple other things to consider. Process matters. Facilitation is an art. And I think oftentimes when people say engagement isn't working, what they're probably pointing to is the facilitation challenge, communication challenge. So identifying a skilled supportive facilitator is always beneficial. Being ready to listen. Sometimes meetings will feel chaotic and messy, but if you take great notes, many of us researchers understand that if you put the pieces together later and organize them, you actually have learned quite a deal, a bit of information. And keeping it simple. Simple materials are good for those that you engage. And if you can keep it simple and explain it, then most likely other people will be able to understand it and provide input. Don't overdo it when you collect information. Open-ended questions, simple questions. You don't have to get into, in this particular method, we want to do this. Do you think that's right? But more of, what do you think is right? What kind of information do you think we need to collect? Those type of questions are going to give you the much more rich amount of information. And sharing information ahead of time is always ideal so that people have the time to digest things if they can and if they want ahead of time. And sometimes we find even providing the 30-minute check-in even before a meeting to process some of the information is always helpful as well. And you could do that right in front of the meeting, 30 minutes before the meeting starts. Next slide, please. Here's just some examples. Amy had mentioned the Bureau of Sages BioSketch. This is a tool. You can see my BioSketch on the left-hand side. It tells you who I am, tells you a little bit about me, and it really does even the playing field around people who you're engaging, who frankly might feel intimidated by researchers and a lot of initials after their name. The next slide, the next example in the middle is a slide that we used when we were describing one of our research projects. And it really just walked through visually the different steps we had for methods to then get input. And the slide right after this is examples of open-ended questions on the third right-hand side here that we posed. As you can see, they're very open, they're very simple, and it just was allowed to give us a lot of rich information to inform our next steps. Next slide, please. So our next steps as a group is really, as I mentioned, it's not as much about having challenge getting the older adults. For us, it's been having challenge getting researchers to understand the opportunities and the methods of engagement that can inform their work. So we're working diligently across the Bureau of Sages partners to identify researchers who want to come and participate in a research advisory board. So please keep that in mind, and you'll see a link to Bureau of Sages to check in and to have your research project informed by the SAGES. We want to keep older adults engaged in learning, even if we don't have a researcher ready this month to engage in research. What we do is we share a journal article, like I said, and we break it down. So that's kind of one of the next steps too, is to just keep the older adults engaged. And as if people turn over, if people no longer want to be a part or functionally aren't able to participate, keeping that outreach and recruitment going. Supporting our researcher readiness, you'll see on the next slide, we have a symposium coming where we're helping researchers to participate. Oh, not yet. One more slide back. Help researchers readiness to participate in the symposium. Participate in research. And we are also figuring out ways to make sure the Bureau of SAGES are sustainable. And that's why the Hebrew Senior Life example is taking some time to get up and going, because we really wanted to make sure that we were working with a partner that had the infrastructure and interest and buy-in for the engagement process to make it work. And of course, identifying funders who support this concept. I think it's a growing concept among many funders, and they're making it really easy to describe the opportunities and include a budget for engagement. Next slide. So you will see when you download the slides, you'll have this link, and this link provides you information to all of the Bureau of SAGES activities and tools and resources. Go right on there to ask for more engagement or to participate with the Bureau of SAGES, and hopefully you'll benefit from the tools that are shared. Next slide. And like I said, April 2020, we were bringing a group of researchers together with older adults to really examine new opportunities for engagement. So please go ahead and tap that email for missy@collectinsight.com if you want to be added to the email list. We look like it's going to be happening in Chicago, but we also are hoping to have a virtual opportunity for connection if people can't travel. So that's it for me, and thank you.
Good afternoon. In case you were late to the presentation, my name is Dr. Jossie Moscow-Jackson, and I'm currently a nurse scientist at the University of Maryland Medical Center. However, my most recent past position was as a program officer at the Patient-Centered Outcomes Research Institute, or PCORI, which was how I got involved in this patient and stakeholder engagement group. So my goal in the last few minutes, which I want to leave time for questions, is to bring together both presentations, which showed models for engaging older adults in the research process. Before I go forward, I just want to make sure that I take a second to make sure everyone's clear on the difference between patient-centeredness and patient and stakeholder engagement, which the latter is what we've focused on today. So patient-centeredness is the art of making sure that the project aims to answer a research question or examine outcomes that matter to patients, in this case, older adults, within the context of their preferences. And also in the case of older adults, patient-centeredness could also include making sure that the questions and outcomes that are important to caregivers are also included, since they're a huge part of the care of an older adult. Now, one way to achieve the goal of patient-centered research project is through patient and stakeholder engagement, which we've been talking about today. Through patient and stakeholder engagement, as you've heard, patients and other relevant stakeholders are included in the research projects and provide really key insight into those key questions to answer and outcomes to examine. And stakeholders can also provide other relevant information that would facilitate the research project, such as information on the most relevant interventions to study, how to reach the population, or the best methods for studying the topic, which is really important. And while the study can be patient-centered without including patient and stakeholder engagement, many, and I'm sure everyone on this panel would say that adding patient and stakeholder engagement will enhance the likelihood of research studies that are both patient-centered, relevant, and useful to older adults and their caregivers, as well as produce study results that will have a higher chance of uptake and use in clinical practice. Next slide. So again, while we just heard two presentations on different models of engagement, I just want to point out that models of engagement can really exist on a continuum, from on the left being a more input form of engagement where patient stakeholders provide input into the research without really being a partner on the research project. And all the way to what's on the right, which is that patient stakeholders are actively collaborating in the projects as a partner or leader on the research team. And in the collaboration type model, the patient stakeholder could be engaged, as I've seen in some of the projects, as either a co-investigator, or I've seen some where they're actually a co-principal investigator on a study. But even in the collaboration model, you could also have a patient stakeholder who's a representative from an advisory group and sits on the research or executive team meeting. So Dr. Carol Geary shared a model of engagement that may be closer to what we'd see as a collaboration or shared leadership model, whereas Dr. Erin McGaffigan shared a model that might be considered closer to the consultation model of engagement. But as I'm sure they would share, ultimately, the type of model of engagement that you decide to choose would depend on several factors, including the needs of the project as well as the resources available. Now, there were many takeaways from both of the presentations we heard today, so bear with me, but the following are some of the key pieces that I think are important to mention. They both provided very useful tips and lessons learned that can make the art of engaging older adults both fruitful and easier, regardless of which engagement model that you decide to choose. For example, Dr. Geary talked about the benefits of a just-in-time engagement summit approach, which really brings together the researchers and stakeholders at the beginning of the project to build that initial connection and build both the patient and stakeholder capacity to engage in the research. And a key element of the pre-planning and actual summit, which was also mentioned by Dr. McGaffigan, was the importance of providing in the beginning an introduction to engagement and commonly used research concepts, which ensures that everyone's on the same page from the beginning of the project, and also that the non-research stakeholders might feel less intimidated and willing to participate. In Dr. McGaffigan's presentation, she also possibly dispelled the myth or showed that technology can be used as a tool to engage older adults and that it should be considered, as she said, which is important in terms of engaging those patients and specifically older adults in the places where they live and are most comfortable. And I think they both discussed the importance of building a facilitator or including a facilitator or a staff support person in the stakeholder advisory group who can assist the older adult to share their experience and expertise. Another takeaway that Dr. Geary mentioned is that engagement groups that are formed don't have to be just for a current research project. And in several of the projects that I managed as a program officer at PCORI, I found that many of the teams tended to stay together even beyond the initial project and continue to collaborate on future studies. So forming those connections between the key stakeholders and the research team, especially at the beginning of a project, is really important for not only ensuring the success of the current project, but also really the success of future projects. And while a different model of engagement was presented by Dr. McGaffigan, I think that she also really highlighted how a freestanding engagement committee that's ready to engage can be both fruitful and help and advise and support not only that current project, but a wide variety of research topics. And then finally, both of them discussed the need to engage in ongoing evaluation and of whatever engagement approach that you choose to take. Whether you're new to engagement or an expert, I think both of them really highlighted that engagement needs may differ based on the project. So periodically evaluating the engagement process and determining whether there's a different model that's needed or additional tools that are needed is something that should be added to the project to ensure that that engagement is really beneficial to the project. Next slide. Now, as Amy mentioned in the beginning, or Dr. Eisenstein mentioned in the beginning, both presentations are great examples of how you can engage older adults in research. And for more examples, I would encourage you to check out PCORI's Engagement in Health Research Literature Explorer, which contains over 1,000 articles on engagement. And the results can be refined by the topic, the type of stakeholder that's involved, and the phase of engagement, whether it's question refinement and design considerations to dissemination. And you have the link here in this presentation that you can use to access that resource very easily. And finally, on next slide, once you're really excited and ready to start engaging those older adults as well as other stakeholders in your research process, PCORI also has an engagement tool and resource repository that provides just a few engagement tools and resources that have been used in their funded projects. And in this particular tool, you can also filter the project by the type of phase of the project and even the patient population, of which older adults I think are listed in there. So you could look and see what resources are specifically used to engage older adults. So I would encourage you to also check out that particular resource on their website. But that is the end of my wrap up, and I will pass it back to the moderator.
Great, thank you. So we will begin the Q&A portion of the program. Just a reminder to everyone that you can type and send questions using the questions feature in the dashboard, which you should find on the right-hand side of your screen. Again, we're not using the raised hand feature today. So if you have a question, please use that questions panel. And also a reminder to everyone, we're recording the session, so we'll send an access link by email once it's available. All right, we've got a couple of questions here, so let me throw out one right now. Who is the facilitator for these sessions? Are they people paid by the researchers? I think that might be one related to the first example.
So this is Carol Geary. For our approach, we had one facilitator for our summit, and she was actually supported the co-leads. We do not have facilitators for our researchers in each of the 10 projects. The research teams are responsible for facilitating their sessions and for managing that independently. It's one of the challenges of our model, and it's also one of the novel approaches that we'll be evaluating as we go through this. I will say that those researchers who have a strong team science background have actually seemed to be pretty comfortable with the process. Those without a team science background, those who are used to a more formal independent research approach are catching on, and they're doing well with it as well.
And this is Erin. I will say we've had a mix in Bureau of SAGES. So in some of these sites, it has been the actual provider site. So a volunteer or somebody from the social work department or activities coordinator supporting the process of facilitation at their nursing facility. Other times it has been a research partner who frankly has kind of taken it on as part of their interest areas. And I think in general, I've seen also other models where independent facilitators have been hired to support the process because frankly, it can be cumbersome. I think what we've found is just making sure it sits for somebody that there's already infrastructure and ability to do this, because that's really what's important, is making sure that once initial funding for a project is dropped or ends, that the process continues. So while it can take resources and funding to find a facilitator, oftentimes we have found, even with the Hebrew Senior Life as it's getting off the ground, it really is about identifying researchers or partners. Hebrew Senior Life is actually part research, part direct care service model, and having people in that entity already interested and ready to support an engagement process has been critical to ensure that it continues. I don't know if that's helpful.
This is Amy. I'm just happy to add to that. Through the Bureau of SAGES model, the staff have created a handful of facilitator guides so that someone who is less experienced or maybe a new researcher getting into team sciences, there are those guides to at least peruse, look through, get a sense of tips and pointers for going about that. So those are all available on the Bureau of SAGES website.
And this is a Carol again. I think there is a bit of a difference when we are reaching out once or twice to an advisory panel or to a source for input on a specific question, as opposed to when we are really doing a collaborative research project in which the partners, the patient and stakeholder partners, are also research team members. And so that when there is a very specific amount of time that we have available to go and gain access to input on specific questions, it's a bit of a different need for facilitation than when we are truly having an engaged team approach to all stages of the research. So I think the need for facilitation can be different depending on which model of engagement you're attempting to put into place.
Okay, great. I will shift to the next question then. Can you please speak to the diversity of participants in the Bureau of SAGES Research Advisory Boards?
Karen, do you want to take that one? Otherwise, I could chime in a bit.
Yeah, I could just start by saying, I guess it depends on how you speak to diversity. I'm assuming you mean racial and cultural diversity. I think it's a challenge. I think for us, it's been more facility or setting based. So if it's, in a facility setting, it's calling upon the characteristics within that facility setting. I do know that we did a virtual seminar series, and you can get information on that at the Bureau of SAGES website, where we did a whole session dedicated to talking with partners about how they have engaged diverse partners in their engagement strategy. So I recommend that you see that. And Amy, do you want to add?
No, I think you got it. It's definitely been a challenge for us, and we've been working hard to expand the diversity of the SAGES and are continuing to try to go there. I was actually going to say too, I believe, Erin, of course you know better, but I believe that's something that will be brought up at the SAGES Symposium in April. I think we definitely need to see some more diversity. The most diverse groups that I've seen so far have been the virtual groups, where they're maybe less focused in one place, but able to get a larger group of people. So it's definitely something we're working towards.
Yeah, in the SAGES Symposium in April of 2020, we did a survey, and it's still live. It's at GSA Connect, as well as I can send it to those who email Missy. But people are saying, researchers that want to come to the symposium are identifying this as one of the #1 areas they want to problem solve with in April. So hopefully people can join us.
Great, thank you. I think we have time for one more question, but I'll just share with everyone that we're not going to get to all the questions today. So we will email responses after the program. So I'll just sort of try to combine a couple of these questions. They're all asking for an example of some sort. So one is, can you provide an example of how a SAGE group has influenced a research project, or what are some examples from Dr. Geary's work, or can an example of a budget be shared in the future?
So I'm happy, this is Amy, I'm happy to give a quick example from the SAGES work, and then hopefully we'll have time for Dr. Geary if you want to give a quick example as well. Over the first couple of years that the SAGES were meeting together, I want to say they saw, I don't remember the exact number, but about 20 different researchers who came in at different points of their research project. And I'm going to talk quickly, but really got a variety of different level of feedback. Several researchers changed their interventions based on the information they collected from the SAGES, recognizing what's going to work and what's not going to work in different settings. Several researchers changed interview guides, changed questions, changed methods for doing interviews. We also had some researchers talking about dissemination, how to get their findings out and make the uptake of findings most useful. So those aren't detailed, but just some quick examples. Also regarding the budget, we have had some researchers come to us and ask if they could write an advisory board payment for an advisory board into their grant proposals, which has been wonderful because that's able then to kind of build that budget, build in payment for the work going on with the SAGES, and then have that process for ongoing feedback.
In following on with the budget, for our PCORI Engagement Award, nearly half of our funding went to supporting patient and stakeholder partners, both for their time and for their travel expenses. So I'm not sure exactly what your question was in regards to budget, but I'm happy to be as open as you need me to be about that. In terms of examples from our work, the 10 research projects are highly variable. We have 2 folks who are working on technology, one that is specifically to support renal transplant patients, and probably the one that's most relevant to this older adult conversation is an app that is intended to assess and support balance for older adults. In terms of how the patients and partners have really changed the research, for over half of these, they are actually working together with the researcher to define the question. So the researcher came with a topic like care transitions from hospital to nursing home, and an interest in what do we need to do here. And so those partners are really defining the question with the researchers. There are other teams where they came in with a tighter question, and they're doing things like designing surveys and those sorts of things. And to be perfectly honest, since our meeting in August, one of our teams has actually already submitted a funding application as co-leaders of the project. So I'm really excited with the preliminary results that we have so far.
Excellent. Well, Amy, Carol, Erin, and Yassi, it's been a real pleasure learning about engaging older adults in research today. And I want to thank everyone for participating. This is the end of the program.